So welcome to all the attendees to this webinar on plain language summaries to support patient experts' input to the HTA, where we will be presenting lessons learned and guidance for patient organizations, HTA bodies, and the industry. The topic addressed today is very timely in Europe, as we are very close to the implementation of the HTA regulation. But it is also very timely in all the other regions of the world, considering the number of people who registered for this webinar. We had about 400 people registered, and so far attending this webinar, we have over 120 people. So I am Antonella Cardone. I'm the CEO of Cancer Patients Europe, and Cancer Patients Europe is a pan-European all cancer types patient association. I am also the co-lead of the HTAI project on the implementation of the SIP. Slide 2, please. I am accompanied today by a set of 5 high-level experts on the topic. So we have Martin Combs, Director of Open Door Consultancy, and this is a consultancy working on public affairs and market access. Martin has gained a lot of experience working with the pharma industry, and he worked on many focused areas such as public affairs, market access. Then we have Celia Meyers, and Celia is a project manager at the National Institute of Health and Care Excellence in the UK. She's based in Manchester, and she works closely with the NICE's people and committee involvement and engagement team. And she's the link between the PCIG team and the medicines evaluation project teams. We also have today with us Hayley Anderson. She's head of patient advocacy at BMS Australia. She works to bring patient perspectives to company decisions and actively supports the patient voice in health decision making. And she was previously the CEO of Melanoma Patients Australia. Julie Spooney is also with us. Julie is the policy officer at the European Patients Forum based in Belgium, and she is particularly focusing her work on HTA. Then we have Dan Kins, who is a public involvement advisor at the Scottish Medicine Consortium. And in that capacity, he mainly supports patient groups involvement in the Scottish Medicines Consortium assessment of the new medicines. And formerly, he was with Myeloma UK. Next slide. So with this webinar, we aim at raising awareness of the summary information for patients approach. We aim at sharing key learnings and best practice implemented during using the SIP, at providing a guide to introducing the SIP in the HTA process, and at encouraging the availability of plain language summary information for the HTA. We would also like to use this webinar as a resource, so we are recording it. So what we will be doing today in this intense 1 hour together. So we will provide an overview of the HTA summary information for patients, so the SIP template. So Martin Combs will lead us through this presentation. We will showcase the learnings from the pilots that were implemented at NICE, the National Institute for Health and Care Excellence in the UK, and at PBAC, the Pharmaceutical Benefits Advisory Committee in Australia. And we will do this with the experts who worked on the pilots and the patient involved in the process. Then I will briefly present on what it takes to introduce plain language summaries in the HTA process. And we will have then a panel discussion with all the experts that I have just introduced to you. Now, in terms of logistics, if you have questions, we would ask you to put the questions in the Q&A session, because, I mean, we have a very intense hour together, and we may not be able to address the questions. But if you make yourself identifiable, we will answer via email after the webinar. After all, though, the webinar won't be a passive for you to answer during the session. So next slide. So having said that, here it is the first question for all of you to answer. So what type of participant are you? So which organization you are representing today in this webinar? You can start voting now. So in a few seconds, we will see the results of this poll. So please vote. So that's very interesting. We have the majority of the participants here today from the patient groups. So that's very encouraging, especially for me as I represent the patient community. We also have some HTA bodies, industry representatives, payers. I mean, this is also very interesting. We have healthcare providers, academic, and also students. So, by the way, we have now over 150 people attending the webinar. So that's very, very good. So now I move on to the first presentation, and I give the floor to Martin, who will present on introduce us to the international SIP. So, Martin, over to you.
Thank you, Antonella. Hello, everybody. Very pleased to be with you. As Antonella said, I'm going to give a very brief overview of the summary information for patient groups SIP template and the project that is under the HTAI Patients and Citizens Involvement Group. It is, as Antonella said, a plain language summary to support patient, expert, and patient group input into health technology assessment. But first of all, before I do that, let's just see how aware everybody is. On the next slide, we're asking a question as to whether you're aware of the summary information for patient groups template. Yes, maybe a little bit, or no. So if you'd like to give your answers and answer the poll, that would be great. See how much work we have to do. So what have we got? Okay, so we've got maybe a split between yes and partially and a no. So we've got a little work to do to raise awareness of the approach, which is good. So very pleased that you've joined the webinar today. So let's start then. Next slide, please. So what is the SIP? So, I mean, obviously the understanding and experience of patients and carers is widely recognized as critical as part of the HTA decision-making process, and patients and patient experts can give that real-life view of the potential impact of a new medicine. So it's important, therefore, that patient experts and patient groups are well informed and have a clear understanding of the medicine under review, and that information is provided in a plain and clear and concise language. So the summary information for patient groups is a plain language summary and describes the medicine under assessment and is designed to support patient and care expert input into the HTA process. Now, typically, it's completed by industry as part of their HTA submission, and then provided to the HTA body, who can review it and provide it to the patient and care experts that are submitting their input into the HTA process. Originally, the SIP was developed by the Scottish Medicines Consortium, and then the HTAI Patients and Citizens Involvement Group adapted it so that it can be used in other countries. So it could be used for international use, and clearly the intention is that countries will adapt and implement the SIP, and that will lead to improved and greater quality input into the HTA process. The next slide, please. So how was it created? Well, as I mentioned, the SMC originated the SIP template, and it was the SMC's public involvement team that convened a short life working group. And I believe Jen Dixon had registered for the webinar. So Jen was the person in the public involvement team at SMC that convened the short life working group, and I think she's maybe in the audience today, so hello to her. And the short life working group was made up of members of the public involvement team, patient organizations, and I was very privileged to be the industry member on the group. Then myself and Lindsay Lockhart from the SMC's public involvement team presented the SIP at an HTAI conference, and it gained interest from a lot of the HTAI stakeholders. And so HTAI Patients and Citizens Involvement Group put together a project group made up of HTA organizations, industry and patient organizations to adapt the SMC SIP so it could be used for international use. And the international SIP template and the guidance associated with it is now published, having taken input from various HTA organizations, patient organizations, and industry to adapt the original SMC template. And it's now published and also published in the International Journal of Technology, Appraisal and Healthcare. And the project group now has been focused on supporting pilots in other countries and also supporting implementation of the approach into their local process. Next slide, please. So what is in the SIP? So these are the 4 core sections that are included in the template. So the first section is very brief, just including a summary of the product, the company that's making the submission, and the HTA organization. And then the second section is about the current landscape, details about the condition, how it's diagnosed, and how it's currently treated. And then the third section is the main section that gives details about the new medicine, how it works, how it's administered, the clinical evidence, efficacy, side effects, quality of life, impact on patients and carers. And then the fourth section is further information that includes things like clinical trial sites, glossary of terms, and the list of references. And associated with the template are guidance documents, and indeed there are guidance prompts within the template itself that prompt the completion to be in plain language without technical information, and to make it as clear and concise as possible, usually about 10 or so pages long. And next slide, please. So where does it fit into the HTA process? As I mentioned, typically it's completed by the submitting company and then provided to the HTA body, who will check the completed SIP for accuracy, for fairness and balance, and also to make sure it's not overly promotional, before providing it to patient experts and patient groups as an information resource that they can use alongside gathering other information to inform their response to the HTA process. It can also support their input at committee meetings, and indeed the plain language summary we know is often used by committee members in the UK and in Australia, as it provides a really good overview of the medicine being assessed. And next slide, please. So we believe that the international SIP should benefit everybody involved in the process to support better input into health technology assessment. But we're looking to see that other countries consider how HTA bodies and patient groups and industry can implement the SIP and adapt it for their own processes. And as has been mentioned, there were pilots conducted by NICE and by PBAC. And so at this point, I'd like to hand back to Antonella to take the learnings from those pilots from our other panel members. Thank you very much.
Thank you, Martin, for this comprehensive introduction to the SIP, despite the limited time. So we can have now on the screen the three speakers who will introduce us to the learnings from pilots. So we have Celia Meyers from NICE, Dan Kearns from MSc, and Haley Anderson from BMS.
Thanks,
Okay.
Antonella. So I think I'm first on the list.
Yes,
so
please.
At NICE, in 2020, within our Centre for Health Technology evaluation, we reviewed our methods and processes. And as part of this, there was some specific work around reviewing how we get patient involvement in our medicines evaluations. Some feedback from that was that only small numbers of patient experts who were involved thought that it was easy to get involved with NICE. And particularly what was difficult was around writing evidence submissions and also responding to engagement steps that include quite a lot of technical detail. There was a particular desire from patient experts and patient organisations to understand what information is useful to us at NICE, and also to have greater transparency around issues that are key for decision making. So as part of this, one of the suggestions that was made during a consultation was that we adopt the SIP to address that need. So we then moved on to make an initial proposal, which was that we introduced the SIP, and that was then consulted on, and feedback from that, it was majorly supported by stakeholders, and particularly by patient groups and experts. So during the pilot, the template originally produced by the SMC was adapted, and then the SIP was piloted in 2021 across, I think it was 6 or 7 appraisals at NICE. And these were in a range of different therapy areas, so we could get a real broad spectrum of feedback from patient experts and patient groups. So we piloted the SIP and then got specific feedback through surveys with patient organisations and patient experts. Positively, we heard that the SIP was really, really useful, but the kind of key learning from the pilot phase was that kind of to emphasize the importance of the SIP being in as plain language as possible, and also for things like acronyms and abbreviations to be clearly explained. I think I would probably put that down to inexperience from industry in completing the SIPs, which is totally understandable given them they were the first ones that a lot of them would have been doing. So from there, we then set up a short life working group, and this was in between January and March 2022. And this was made up of members of patient organisations, patient experts, NICE committee members, and also NICE staff. And during this time, the purpose of the group was to advise and produce recommendations on the implementation of the SIP in our standard processes. So the plan was that all appraisals at NICE, so all our medicines evaluations starting from February 2022 onwards, would include the SIP. And then the template for the SIP was updated and guides created both for industry in terms of completing the SIP and also to support patient experts and patient organisations when reading and using the SIP. They were created and adapted also to implement the learnings, particularly around the need for plain language and explanations of abbreviations. So the guidance was adjusted to make it really clear to industry the importance of plain language, some examples of what to say, what not to say, and the importance of outlining any abbreviations or any acronyms. So those materials were then created, and then the information about the SIP was also then incorporated into existing training and supporting frameworks for patient experts and patient organisations. And then additionally, in terms of monitoring and measuring the success and the impact of the SIP, questions around the SIP were added to existing experience surveys that we have for patient experts, which we do for all patient experts after they attend committee meetings. So as a result of that, we obviously regularly monitor those surveys, and the feedback is that the majority of patient experts are using the SIP when preparing their submissions to NICE, which is really positive. We kind of continue to monitor that and continue to monitor whether there are changes that we can make to any of the supporting documents like the guide or the guidance within the template itself to make it more useful. But we're hearing really positive things, and it's now been over 2 years since we've been doing it, and it just feels like it's kind of one of those things. It feels like, why haven't we been doing it forever? But Dan, who is on the call, is one of my fellow panel members, was part of that short life working group. So I will pass over to Dan to give a bit more information about that from his experience.
Perfect, thanks, Celia. Yes, I'm currently the public involvement advisor for the SMC, but in this section I'm wearing my old hat because I used to be a patient advocate for a patient organisation called Myeloma UK, and as part of that I took part in the short life working group for the development of the SIP form with NICE, and it was a very positive experience being part of the short life working group, collaborating on this project, and there were a few learnings from it which I think are good to share on this webinar. And I think firstly, and I think this is probably a good point for most short life working groups, was they really had the right people around the table, and that firstly comes from they had good patient group representatives, a good mix of patient groups from different disease areas alongside patient experts who had experience of NICE processes, but they also had experience of using things like the SMC's version of the SIP, and they were able to come in and use that knowledge and experience to help develop and give recommendations on how patient groups use the SIP, what information they'd like from it, and how NICE could implement that into their processes. But I think also crucially, NICE the NICE short life working group had the right representatives from NICE sitting on the short life working group. It wasn't only just members of the public involvement team. There were members of other parts of the NICE assessment team, alongside a couple of NICE committee members. There was a committee chair as well as a lay representative, so they were able to come in and bring all of their experience for where they think patient evidence is useful in the decision problem, and where the SIP form can maybe help inform patient groups. So it was a really good collaborative effort from all the participants to put that together. So I think the last thing I would say about the short life working group was it was just in general just a great example of public involvement practices, with clear information and asks, and genuine collaboration on the development of the SIP form, where opinions from all members of the group were listened to. As I said, as Celia said, sorry, we took the SMC version of the SIP, which had been sort of developed into the HTAI sort of template for the SIP form, and we were able to sort of work together and really adapt that to NICE processes. We were able to then adapt that also to how patient experts and patient groups would use the SIP form, and then it's now, as Celia said, has been successfully implemented in NICE for a good couple of years now. So all in all, it was a very good experience. Thanks, Antonella.
And I think maybe Maybe me, Antonella? Yeah, thank you. I think I would also say that reflecting on what Dan's just said in terms of collaboration, that was certainly important and key to the Australian pilot, as I think was the really clear goal that we all shared in ensuring that patients and patient organisations, particularly for the Australian pilot, received the information they needed in order to help them participate in HTA processes. So the sort of the beginnings of our pilot, I think, really stemmed from a recognition and an increasing amount of feedback from patient organisations, but also Department of Health and HTA body, PBAC, that there really was an information gap that existed for patients regarding what was being submitted by companies and what was actually being assessed by the HTA body. So with that sort of swirling in the background, we had a bit of a perfect storm, I suppose, where we were all aligned on the importance of doing a pilot and to really act in getting that up and running quickly. We had Australian patients, as I say, they were sort of increasingly frustrated by the lack of information that was available to them. Our Department of Health had recently established a unit with a particular focus on patient engagement, and they were really interested in exploring some options that might better ways in which patients could engage with HTA processes. We, BMS, had, we were really looking for an option to support patient engagement. We had done a project not too long before the pilot called Broadening the Evidence, where we really wanted to understand how patient organisations felt that patient engagement with HTA could be improved, and this was a really strong recommendation. And then, of course, completing the perfect storm was the fact that the HTAI template was there and available, and it really made a sort of an easy-ish pathway to the pilot, and we could leverage the international learnings, I suppose. So our pilot started sort of similar timing, I think late 2020 into 21, and we started with BMS with 2 submissions, one in lung cancer and one in mesothelioma. That was very well received by all that were involved, including the patient organisations. In the lung submission, it was just one key or a couple of key organisations, but in mesothelioma, we had a lot of state-based organisations, so it was quite a significant number of patient organisations received the summary and participated in the process. After our submissions, it was extended to a further 7 companies. So all of us worked together with the department and with the patient organisations. Similarly to Celia described, there was guidance given for companies in how to complete that template. There was also advice given to patient organisations for how they could use the summary and what they might use from it as they put their submission forward to the HTA body in terms of their views on the medicine being assessed. And I think I think it's also important to note that like NICE, we customized and localized based on feedback from everybody. So and I think that was really important to ensure that it had a local Australian flavour, I suppose. In terms of where we're at now, I wish that we were the same, but we have not yet implemented. And I think sort of probably the biggest kind of barrier to that implementation is that we have entered into a huge policy piece called the HTA review, and that is the first review of our HTA system or policies and methods for more than 30 years. And I am hopeful that the summary of information pilot work will come through, and it's certainly been spoken about a lot, the importance and need for plain language summaries. So when we have a response from government on that report and review, I'm hopeful that our implementation will be as swift as we implemented or started our pilot.
Thank you. Thank you to all the panelists now. So maybe we can go to the next slide. I mean, they provided a clear overview of how the pilots were implemented and how successful the pilots were, and how important it is now to move on from the pilots into the standardized use of the SIP throughout the HTA process. So I will present on what it takes to develop a SIP throughout the HTA process. So next slide, please. So we have heard that from the pilots, the SIP has been appreciated both from expert and experienced groups of patients, and most of all from less experienced group of patients. So the patients do appreciate the SIP. Because the SIP provides clarity around the patient population, comparator, place in pathway, and the administration. Of course, it helps reducing the burden on the patients. As I always say, patients should not become health economists in order to be successfully involved in the HTA process. But of course, they need to be brought up to speed with the concept and with the language. So the SIP facilitates the patient's role in the HTA process. And also it reduces the risk of misunderstanding as patients gain confidence and gain confidence in the input that they can provide. And the SIP can also be useful to other stakeholders other than the patients. We can also think of something similar to the SIP for healthcare providers or for policymakers, for instance. Next slide. So at the HTI project, we have developed guidance documents for the industry, for patient experts organizations and the HTA bodies. And I also see a comment in the Q&A session on the fact that the SIP and the use of plain language is not a new concept to the industry because they're already using plain language summaries for patients when involving them in clinical trials. So the concept is not totally new. So also we have listed the key steps that should be should be considered when including the SIP, when promoting the SIP into the HTA process. We have heard that it's important to gain, we heard from the speakers before, from the people who were involved in previous pilots, that it is important to consider the current HTA process to check the feasibility and gain the buy-in of key stakeholders. The HTA bodies where the pilots were implemented so far, they had in particular, since they were particularly sensible to the involvement of patients in the HTA process. Then it's important to establish like short-term working group to pilot and adapt the SIP to the specific HTA process, it's important to establish a pilot, and it is important then to review the pilot and evaluate the success. And then the next step after the pilot is the adoption. Next slide. I have finished with this. So now we will move into the panel discussion. So I would like to see all the panelists on the screen. So with the discussion, I will ask the first question to Julie, EPF. So the new UHTA regulation in Europe is still in a development phase, and it still is standardizing how patients should be involved. So how do you see the SIP adding value in this process, and how the SIP could facilitate the patient involvement across Europe?
Thanks, Antonella, for the question. And yes, with the new EU HTA regulation, patients will be involved at different stages of the HTA process at EU level. For instance, they will be involved in joint clinical assessments, which will assess the clinical aspects of the technology. They will also be involved in joint scientific consultations, which will provide scientific advice to health technology developers on the design of clinical trials. But also at national level, patients will be able to contribute to the scoping phase, which will feed into the EU HTA process. We are still working out how patient involvement will work in practice, because not all implementing legislation have been adopted and some question marks remains. But this is already clear that the SIP would be crucial and will add value to the process and will ensure the appropriate involvement of stakeholder organizations, but also patient experts. Because we already know that patients will have just under a month to contribute if they are invited to on the draft joint clinical assessment reports, in the meetings, and also in the revised final reports. And in addition to these time constraints, we know that there are barriers to optimal involvement of patients. We mentioned that there are difficulties in understanding the complexity of medical information being assessed. I mean, this isn't news, but HTA is technical in nature. And patients, they need access to timely, clear, and accessible information about the technology they are being asked to comment on. And in addition to these time constraints and barriers to patient involvement that I mentioned, there's also a challenge that's very specific to the EU, because we have 27 member states and they have very different patient involvement practices and resources, which result in different levels of maturity of patient involvement practices and consequently fragmented patient involvement outcomes at national level. That's why the availability of a SIP as early as possible would be really important, not only for patients to provide timely and relevant input, but also to ensure a level playing field across EU member states. And unfortunately, there's currently no provision of a SIP in the implementing legislation and in the regulation. But this is something that we at EPF and also other patient organizations are pushing for, and we hope to see it embedded in the implementing legislation to ensure that we have this meaningful patient involvement and it's not just a tick of a box exercise.
Thank you, Julie. That's a very interesting call to action that I totally adopt. So now, Dan, over to you. So as during the pilot, you were from the patient side. So what have been and what are the main benefits of the SIP for patient experts participating in the HTA? And then Celia, if you want to complement after, if there is any thing that you want to complement after Daniel answered, then you're welcome to do so.
I think in an easy or a clear answer is that it provides detail regarding the medicine assessment in an easy to read format. So I think as Julia has just said there, it covers HTA is technical and not everybody is an expert in it. And it's our jobs as an HTA representative and as well as industry to make that as accessible as possible for patients and patient groups to get taking part. So I think a SIP form provides that information in an easy to read format. It covers really good depth on where patients and families can benefit from the medicine, and also covers any challenges associated, which can help the participating patient or patient expert to understand the assessment and the decision problem. And this can correlate with the type of evidence the HTA bodies are interested in, and thus it can help improve overall patient group and citizen evidence that we take in. And then finally, it can make it easier and less challenging for patient groups and citizens to get involved in the assessment in your country, which is what we're all keen to see. We're keen to see increased patient participation in HTA.
Thank you, Dan. Celia, would you like to complement?
Yeah, I think, I mean, Dan has pretty much outlined it. But from my experience as well, one of the things we see particularly at NICE, because we have such a high volume of assessments coming through, you know, we as a program look at anywhere between 100 and 120 different indications, medicines in specific indications in a year. And so we do see as well that for particular patient groups, if there are, you know, say 5 or 6 different assessments going on at the same time, say for lung cancer, it's really challenging sometimes to pick apart those different assessments and the particular issues that are relevant for each one. And so I think the SIP can kind of help clarify that in the minds of the people that are writing these submissions. And again, that can only be a good thing, reducing time, reducing burden, like you said, Antonella, for patient experts and patient organisations. And obviously that then improves the quality, which, yeah, like we all want.
Thank you, Celia. So now the question first to you, and then Dan, if he wants to complement. So if we think about HTA bodies contemplating the adoption of the SIP, what are the main lessons, positive and negative, from your experience of piloting the SIP? So what would you like to highlight for those HTA bodies who will soon start implementing the SIP?
Yeah, I think for the experience at NICE, one of the main lesson is to make sure that you have kind of appropriate feedback formats, feedback procedures in place. At NICE, our public involvement team, in my opinion, are amazing, and they have a long history of making sure they have really clear feedback processes. And so it's meant that when we've adopted and implemented the SIP, it's just been slight changes to these existing feedback processes, but that means that we have a cycle of feedback from patient experts and patient organisations. So it means that we can really closely monitor the success of the implementation, and also kind of have a continuous improvement process in terms of looking at whether there are tweaks needed to the template for the SIP itself, whether there is information that we can add into the guidance to make it more useful. And I think that listening to feedback has been really important in terms of the success of implementing the SIP. And yeah, particularly that example around clarifying what plain language means for industry, and making sure in the template that it's clear. There's areas like the glossary in section 4, and making sure it's really clear that industry, that is an essential part of completing the SIP, is that you need to outline what your abbreviations mean, what your acronyms mean. And that's meant that moving from the pilots into the implementation phase, it's had kind of an increased level of usefulness for patient organisations and experts.
Thank you, Celia. I don't know, Dan, if you have anything to complement.
Yeah, I think from an HTA body perspective, I think having clear guidance over how to draft the SIP for industry is really key, helping them to sort of give the best information as possible to patient groups. But I think that also correlates to having good relationships with industry, to be able to go back to them and speak to them about the SIP forms if there's ever anything we need to clarify with them, or if the patient group has questions about it, for us to go back. So I think my one piece of advice to industry on that would be to include contact details for who's drafted the SIP from your end, so that we can link in with them, and then we can even link between the industry who's made the submission and the patient group.
Thank you, Dan. And now a question for Hayley. So from the industry perspective, what have been the issues and challenges for the industry in participating in the SIP pilots and completing the SIPs? There was a question in the Q&A that I just saw about how the industry can overcome the risk of promoting a product. So this is also important to consider. So over to you, Hayley.
Yeah, well, I think perhaps in terms of completing the SIP, I think it is a challenge. You know, it definitely is in terms of trying to provide very complex information in a way that's easy to understand. And that's probably the biggest challenge. I think we improved over time as we sort of did more and thought about more and how we could present information in a way that might be better understood. But certainly our experience, as I explained, the two indications, and so the range of patient expertise was significant, and it is a challenge to meet all of those needs in one 10-page document. But all of the information that we receive back from patient organisations, and we definitely do include contact information, and we do have relationships with patient organisations and are more than prepared to discuss things. I think the balance of promotional, I would say in Australia we have very strict legislation that prohibits promotional content or discussion, and what I would add to that, though, as another challenge perhaps, is that whilst it's very clear when one is being entirely promotional, and that should never be included, industry can be incredibly conservative and therefore not feel confident sharing perhaps things that should be shared. So I think in my experience, I think there would be benefit from sort of clarity around maybe guidance, better guidance, or more guidance around what can be included. But by and large, the industry was supportive. The Medicines Australia, the industry body, surveyed member companies, and there was a strong level of support for this project.
Thank you, Hayley. And so how can the industry be better supported to complete the SIPs during the HTA process?
I think that the guidance is particularly important. I think that there could be training. I mean, I would also say that we did not in our pilot have a short life working group, and I think that would have added value. And I would certainly hope that we will adopt a similar sort of group for the implementation phase. And I think particularly ensuring that there's clarity around what companies have confidence around that legislation, so that they can feel comfortable what they are sharing and that it's right to be shared.
Okay, thanks, Hayley. And Martin, from the HTAI perspective, then how can the industry be better supported? So what the HTAI could do, and what would be needed from the industry in order to help them implement the SIP?
I think having a consistent approach is a good thing because companies are global companies. So HTAI, I think, in raising awareness of the approach, is doing a good job to make sure not just industry but everybody is aware of making sure patient experts and patient organizations have the information. But for me, it's encouraging companies to adopt the approach early in their process and to include it in their global value dossiers, so that it's a standard thing in the same way as they do at the moment for clinical trials. So plain language summary information should be included in the global value dossier so that it can be adapted and used at local country level.
Thank you. Then another question for Celia and Dan. So when adopting the SIP, how do you prepare and account for questions and perceptions of industry and patient group bias? I mean, this is, you know, it's a risk. So how do you prepare for that? So maybe Dan, you can start.
Thanks, Antonella. Yeah, I'll cover the patient group bias side of things, and let Celia talk about the industry bias, because I think we've got very similar approaches across SMC and NICE. But on the patient group side of things, in the SMC, we review all patient group submissions that come into us. So we read them through and we go back with advice on how to strengthen the submission. But we also have, when sending out the SIP form, very clear guidance that no information should be copy and pasted from the SIP form and put into the submission form. So when we're reviewing it, if we come across any information that has just been lifted from the SIP form and put into their evidence, then we're not going to accept their submission, and we're going to go back to them and say that they need to redraft that and send us a copy that's more acceptable for us to take forward. So that's how we sort of work with patient groups to sort of get beyond that, but also help them provide as strong a submission as possible.
Thank you, Dan. Celia?
Yes, so in terms of questions and perceptions of industry bias, firstly, I will say that in the template itself, it's very clear that this is a document that was produced by the company that's marketing the medicine. And what we do as well, whenever we get a SIP in, we do like an internal review, quality assurance check of the document before it is shared anywhere. And this is particularly around inclusions of comments around cost effectiveness, which obviously that is the role of the HTA body to determine that rather than the company. So one of the things that we do, we don't, I think it was shown in Martin's slide actually, is that we don't edit the SIP ourselves, but we review the SIP and then we can send it back to the company who's produced it to request changes, and particularly removal of statements and assertions around cost effectiveness, because it's not helpful really, and it's misleading for patient groups, because a company's results may be cost effective, but the decision-making results that the committee look at may not be the same ones. So it's really important that we kind of keep that out of it, and that it's just around the clinical and cost effectiveness issues related to the technology that patient organisations and patient experts need to be aware of.
Thank you, Celia. So we are perfectly on time. If we were live, I would say a round of applause for our speakers, our panelists. So thank you for the focused discussion. We got really to the point. You answered to the point about the questions posed. So thank you so much for that. So we can wrap up, start with wrapping up, and go to the next slide. So, well, to wrap up, I could say that it came out very clearly today that the SIP is a tool that can facilitate the patient involvement in the HTA process, not only from the patient side, but also from all the other relevant stakeholders involved. All the pilots that were implemented so far in different regions of the globe demonstrated this. So we are now working on the promotion of more pilots in other regions of the world. And we are also looking for more partners joining the project from different stakeholder groups. But essentially, we need more industries supporting the initiative and more patients actively involved in the advocacy work to promote the implementation of the SIP. So next slide. So we have last poll. So should plain language summaries information be made available to support patient and citizen involved in the HTA? So what is your view? I mean, throughout the webinar, we have presented the benefits and some of the challenges of the SIP. So what is your view? Should the SIP be embedded into the HTA process or not? We will show the results in a few seconds. Please express your view. I hope we have convinced you of the importance of the SIP and the benefit. Okay, so we did. In case there were some uncertain people, like we have 92% supporting the implementation of the SIP. Still a few are uncertain, so we need to work on this few, hoping that this few uncertain are not among the HTA bodies and the payers community. Thank you. So we go to the next slide. If you want to look for additional information on the SIP, you can check the HTAI website where there is, I mean, the landing page now on this project on the SIP is under structuring. So, but all the information on there, all the guidance are there. There is also an article that we have worked on that is accessible, and you can access it through the link provided here. And also, if you have any questions and you need you want to understand more, we both myself and Martin are able to answer your questions and also set up bilateral calls if needed. So next slide. So this is this is a slide that acknowledges all the people who have been working on the HTI project on the SIP. So I am co-leading this initiative together with Jose Diaz and Mariah Morris from BMS. We also have HTA bodies involved in the project. We have patient organizations, industry, and Martin, who is an essential pillar to the HTI project on the SIP, because I mean he's managing the secretariat, and all this could not happen without his work and support. So next slide is just to reiterate that we thank all the participants, and you can reach out to both myself and Martin if you have any questions or if you want to understand more, if you want materials, or as I said, set up a dedicated call. So thank you so much, and we can the webinar. Thank you to all the speakers and all the attendees. Thank you.